Good morning, everyone, and thank you for joining today's webinar. Today, you will get a chance to understand how your risk adjustment challenges can be converted into opportunities with the power of natural language processing. Before we dive deep into it, there are a couple of things that I would like to bring to your attention. If you have any questions during the presentation, please type them into the question box in your GoToWebinar control panel. I'll bring them up towards the end of the presentation and the presenters will answer them for you. Our presenters today are Zaima Ahmed, a business analyst at Persivia. Zaima brings a wealth of knowledge with her when it comes to risk adjustment. She has been working closely with our clients to help them devise a successful risk adjustment strategy and to drive their risk adjustment program to success. Our second presenter is Gurpinder Singh. He is a technical business analyst here at Persivia. Gurpinder is a tech genius and helps in bridging the needs of our clients with what our technical team can deliver. He is currently working on unlocking the potential of natural language processing for our various clients to improve their risk adjustment processes. At this time, I'll turn the time over to Zaima and Gurpinder to start their presentation.
Thank you, Rudy. I'll take it from here. Welcome to our presentation on accelerating your risk adjustment program with NLP. Let's begin with a welcome to our presentation on accelerating your risk adjustment program with NLP. Let's begin with a quick update on CMS risk adjustment. CMS will continue to calculate 100% of the beneficiary's risk scores using the 2020 model, version 24 relative factors. CMS will also continue collecting diagnoses exclusively from MA Encounter data, as RAPS is no longer needed or counted towards calculating the patient's risk scores. In 2023, CMS will update the ESRD models. Now I just want to talk about some of the challenges with risk adjustment. Firstly, risk adjustment is laborious. Since there are many uses for the HCC risk adjustment, organizations are spending a lot of time and resources on risk adjustment because the process is laborious and error-prone. Traditionally, there was a lot of manual chart review, which was inefficient and costly. Next, risk adjustment teams wear many hats. As there are continuous updates to the HCC risk adjustment, such as changes in the coding requirements, this requires proper documentation to calculate more accurate risk scores. So provider education is very important here, and data quality insurance will help optimize the workflow seamlessly. And lastly, data quality is a very big deal. Poorly documented patient information can translate into less reliable risk scores, and this can risk an inaccurate representation of the health needs of the members. Therefore, extensive training by providers to know which disease to report and where to report this information can greatly improve risk scores. Continuing on, all roads lead to risk adjustment. There are many value-based programs that use risk adjustment. These are Medicare Advantage, the Affordable Care Act commercial insurance marketplace. We have Accountable Care Organization, the merit-based incentive payment system, and other several Medicaid programs that factor in risk adjustment to determine performance. Some of the newer models are PCF, which is the Primary Care First model program, where risk adjustment is directly tied to the reimbursement. The ACO REACH program, where the risk adjustment is tied to the health equity, and the revised MSSP program. So what does this mean for the providers? Well, what this means for the providers is that it places significant pressure on the organizations to optimize their risk scores by properly documenting the severity of illness of the beneficiaries. So this in turn is used to determine the performance in a growing number of healthcare models. And this trend is likely to increase, impacting providers, payers, and emerging payvider models. Let's take, for example, the MIPS program. Yes, okay. So with over 1 million providers participating, the pressure to accurately determine the severity of illness through proper diagnosis, documentation, and coding is even greater now, has an even greater significance now because it will determine whether provider organization receives a positive incentive or a negative MIPS payment incentive. Now I will pass it on to my colleague, who will take you through the role of NLP in the risk adjustment data.
Hi everyone. Talking about data sources that drive risk adjustment. There are numerous data sources from where the data is collected and prepared for risk adjustment processes. So, the sources mentioned here are in the order of complexity, with number 4 being the most complex. Let me elaborate a bit on one of these. Claims. These cover dropped codes from HCC, ICD-10, and other dictionaries from previous years. Pseudocodes or codes documented by other providers are included as well. Second, the clinical EHRS. It includes incorrectly coded data, inference-based data. For example, if a medication is prescribed and diagnosis is not codified, it will affect the risk adjustment. Third, the coding lab values, medications, etc. with respect to HCC or quality measures. Third, the HRAs. HRA, sometimes also known as health appraisal or health assessment, is a screening tool that helps individuals identify and understand their health risk and monitor health status over time. A health risk assessment includes a questionnaire, an assessment of health status, or a personalized feedback about actions that can be taken to reduce risk, maintain health, and to prevent diseases. Now, the most complex one, the physician notes and other unstructured data. Unstructured notes are the most complex form of data source that drive risk adjustment. Other unstructured notes include discharge notes, nursing notes, etc. These notes provide most number of opportunities for patient care and money. The data dilemma. As we mentioned during our last slide, the unstructured notes are the most complex data source to drive risk adjustment. At the same time, they provide us countless opportunities for patient care that we will be talking about in this presentation. Here are some of the numbers. 75% data in all nodes is in unstructured form as of today. There are more than 4,000 unstructured characters in electronic clinical records. More than 100 million medical records reviews are conducted each year, and these clinical records can average up to 80 pages per clinical record. These numbers might look overwhelming, but we do see the opportunities hidden in this data that can drastically improve the risk adjustment program from both the cost and the care perspective. Talking about the role of AI and NLP, dealing with unstructured data. $150 billion is the number artificial intelligence can potentially save in US healthcare annually in next 4 to 5 years. Healthcare entities can easily eliminate manual paper-based administrative and clinical processes that are often repetitive, labor-intensive, and cost-ineffective using AI. NLP can help us to classify, extract, and segment a variety of unstructured data from the EHR. Also, NLP assists in improving identification completeness and accuracy in capturing risk-adjusted conditions. Our NLP engine has been built in such a way that it will pick up ICD-10 code items like medication anywhere in the patient profile. For example, in diagnosis, assessment, active problems, labs, or even medication section. More conditions it will capture, greater will be the RAF score. More than 17% of the patient data like encounter notes or discharge summaries existed in an unstructured format containing suspected HCCs. Now, how do we deal with them? One, we can summarize blocks of narrative text such as clinical note by identifying key phrases present in the source material. We can improve clinical integrity by mapping data elements present in unstructured text to structured fields in an electronic health record. We can convert data from machine-readable formats into natural language for reporting and educational purposes. We can answer unique free text queries that require the synthesis of multiple data sources. We can engage in optical character recognition to turn images such as PDF documents or scans of care summaries and image reports into text files that can be parsed and then analyzed. Also, we can use speech recognition that will allow users to dictate clinical notes or other information that can be then turned into text. Automating the risk adjustment process. Risk adjustment requires complete and accurate coding of conditions year after year to one, accurately account for complexity, and two, to reduce the risk of low rates of reimbursement. Using NLP, one, uh, we can put clinically relevant information in patient's medical record by ensuring coding efficiency is streamlined, removing the need for dedicated health plan staff to follow up with the providers. NLP can also help in flagging members with specific codes and automatically determining their risk based on diagnosis, gender, age, and thus automating the risk score calculation. Once we have an intelligent software that can eliminate the need to retrain internal teams and provider networks when regulatory changes alter risk adjustment methodology. An AI-driven solution can take the complexity out of the risk adjustment program by automating the processes. That means no more administrative burden, no fear of missing out on codes and rev opportunities, and at the same time, best care is delivered to the patients. Automating SCC risk adjustment by leveraging NLP allows an organization's risk adjustment team to focus more on potential uses for risk score and less on the process for calculating these scores, which results in one, new HCC coding opportunities, two, accurate, accurate risk adjustment factors that obviously affects the revenues and savings drastically, third, suggesting appropriate codes to the provider. This is a real-time clinical decision support for providers at the point of care. This means taking the cognitive burden off the providers and improving their efficiency to deliver the best care. What can Persivia's NLP engine deliver? Persivia brings a next-gen risk adjustment solution for the HCOS. It employs artificial intelligence, NLP, and machine learning to make the most of the data, make it actionable, and deliver the best results. Our NLP engine unlocks the hidden diagnosis and other important patient information hidden in the unstructured notes. Converting unstructured note into a structured document. Here is an example on your screens. An unstructured note written by a provider is processed using NLP and segmented into different categories like history of present illness, medications, indication, information source, general description, and a lot more. The structured format not only allows to understand and analyze patient data in a better way, but also provides an opportunity to look for missing coding opportunities, thus ensuring high level of patient care. I'm going to request my colleague Zaima to take over this slide and help you guys here.
Thank you. So how does NLP help deliver the real value from the patient's medical record? We take the unstructured clinical notes, which are read by our NLP engine. These extract insights from the chart information, transforms it into a coded data element. Then our NLP captures a wide variation of medical terminology. We also discover previously missed or miscoded conditions. Our NLP also allows for real-time capture of codes at the point of care, where the codes are presented right at the assessment screen for physicians, so they don't miss out on any HCC opportunities. We automate a chart review to identify clinically relevant information. NLP provides more accurate RAF scores and are able to create structured clinical reports from unstructured notes. Example of how we have used NLP. So we found a medication for diabetes in the patient's notes section, but it wasn't coded by the provider. So NLP picked this up and suggested a code to the provider for diabetes. Now, this will help increase the RAF and affect the patient's risk score. Another example is when NLP helps in finding missing drugs from the notes that a physician should know prior to writing a new prescription to avoid a contraindication. Thank you.
The magic of Persivia's NLP engine. So these describe the steps we follow using our NLP engine. The first one, clinical note segmentation. Clinical notes are one of the key components to communicate patient's current status. Data cleaning and sampling is performed, ensuring that the notes or the unstructured notes does not contain no information or no irrelevant information. We do the feature segmentation, dividing groups into 4 different segments. 1. Demographics, encounters, diagnosis, and other information. Once done, we extract all the patient diagnosis or problems from clinical notes using name entity recognition, also known as NER. NER predefined categories to identify problems from the clinical notes. These categories are ICD-10, main disease, sub-disease, synonyms, and abbreviations. Once done, the diagnoses are codified to HCC with the help of NLP rule engine. List of diagnoses are passed from the unstructured notes or the patient records. Diagnoses are available in either string, numeric, or both string and numeric formats. It is then parsed through NLP pre-processing steps to normalize data in required format. NLP rule engine also do help in providing the description if the code is provided. If diagnosis description matches with SNOMED and ICD-9, NLP rule engine is capable to be mapped to SNOMED CT and ICD-9 to HCC if the mapping of HCC is available. Once done, we extract patient's active problem from the clinical notes using NLP. Active problem list is passed from active problem section in segmentation. Patterns are then identified and analyzed to parse problem list. Once done, we codify the diagnosis with ECQM. List of problems or diagnoses are passed from patient notes. ECQM codes are used to codify diagnosis using multiple NLP techniques. Existing diagnosis data has been taken for NLP pre-processing. We also provide description if code is provided.
Okay,
Azaiman?
so thank you. So here are the outstanding results that we have achieved through our NLP engine. So some of the benefits that we have been able to achieve through our NLP is being able to process millions of charts to a higher specificity, where we achieved 90% accuracy, 90% sensitivity, and 95% in specificity. We have also been able to review thousands of records per hour. NLP has accelerated the time from chart retrieval to final structured data output. And implementing NLP lowers the coding cost per chart, thereby increasing the revenue and overall improving the ROI, as we were able to detect 100% more HCC coding opportunities. Next. I'm just going to talk about NLP in our products and how NLP has helped with integration at the point of care. So there is no need at the point. So with the Persivia Care Track, this integrates appropriate data into the client's EHR, and at the same time delivers appropriate HCC codes, RAF, and risk scores to the provider at the point of care in real time. There is no need for the provider to go log into a separate platform, as CareTrack provides all of the clinical insights seamlessly at the point of care alongside the provider's EHR workflows. It's used as an extension while the provider has the patient's record open. We also provide supporting dashboards for the provider's coding team, such as the HCC comparison portal. This allows the provider or its coding team to compare the current year's performance with the previous year's performances. It also allows the provider or the coding team to accept and reject suggested HCC conditions, and also allows them to enter a new diagnosis code which is mapped to the latest version of HCCs. So here, once the code is accepted, it can be pushed directly back into the provider's EHR. So all in all, this leads to the provider's satisfaction. Next, please. So let's talk about how it all comes together. So we take data from claims, clinical, and the payer files, and we analyze this data. We analyze the data from structured data and unstructured data using our NLP capabilities. Then all of this data gets aggregated into a single longitudinal patient record, which is then processed by our AI engine, which uses decision support and machine learning to generate risk scores, patient insights, opportunities for HCC coding. Now, all of this actionable information is presented to the provider at the point of care where the results are immediate. You will see that the overall quality of care improved, coding accuracy improved, and the costs come down and revenues go up. So your patient population and provider will both feel satisfied with a true value-based experience. Thank you.
Talking about the Persivia's NLP success story. The Persivia's language model is built to categorize the HCC knowledge base. This model works by tagging each English word with parts of speech tagging patient's problem after pre-processing with combination algorithms and n-grams techniques. Diagnoses are mapped with HCC based on categorization rule engine. Our team at Persivia have analyzed more than 4,200 nodes using our NLP engine, which identified more than 9,800 diagnoses, of which only 3,100 diagnoses were mapped to an HCC category, compared to 1950 by EHR, which is roughly 60% more codes. These results are testament to the fact that Persivia's NLP engine can identify far more HCC codes than the leading EHRs. Better for you, best for the patients. So our overreaching vision of enabling personalized care for all is achieved through the diversified capability of our platform, which harnesses the power of artificial intelligence and data to deliver the right care at the right time, thus reducing your cost, improving quality, and significantly impacting our organizational efficiency and revenue. Thank you.
Great. Thank you everyone for joining. We appreciate you being here on this webinar with us. And as always, we'll email you the webinar slides and the recording in the next 24 hours. Thanks again for joining us today. Hopefully you found this session useful. We will see you next time. Have a great rest of your day, guys.
Thank you.
Thank you.